Hello, my name is Heather Cormier, and I'm here today for Nursing 612, Assignment 9.2, Practice of the Head to Toe Assessment. With me today is Philip, who will be my patient for my head to toe assessment. And today we'll get started by just gaining a little bit of insight into why Philip is here and his past medical history, as well as some family and social history. So welcome, Philip. Can you give me a little insight as to what brings you in today?
Just to establish care with a new provider.
Okay. So in order to get started, I just want to get a little insight on your past medical history.
Okay. In the past, the only surgeries that I've had, I had a vasectomy, and I had a reversal as well. And had my gallbladder removed probably about 4 years ago.
Okay.
Something like that.
And that's been your only surgical history?
Yes.
Okay. What about medical history? Any high blood pressure, high cholesterol?
About 4 years as well. I was diagnosed with high blood pressure. The last lab results I had may have shown a little bit of elevation in my cholesterol.
Uh-huh.
Yes.
Okay.
So control that pretty much with diet.
Okay. Now with your surgery, were there any complications?
No real complications with the surgery itself. After my gallbladder surgery, I experienced some discomfort, associated with the gallbladder being, going. And I was put on some Equestran for that.
And what was that used to treat? Was it like a post-operative GI problem?
Yes.
Okay.
Yes, it was.
Okay.
And it also helped with the cholesterol.
Okay.
So
Great. Great. Any other medications that you take?
I take Valsartan. We started off with Diavan, 80 milligrams when I was diagnosed with high blood pressure, and now I'm taking Valsartan, 80 milligrams.
And how often?
Once a day.
Okay.
Every morning.
Okay. And what about that Questran? How often do you take that?
That I also do every day, every morning. Just about 2 milligrams, whatever the half packet is.
Okay.
And that seems to be controlling everything just fine. So.
Okay. Any over-the-counter meds or vitamins that you take daily?
Other than Advil or anything like that, just for regular headache or.
Okay.
Basically it.
Okay. And no other medical history besides high blood pressure?
For myself, no.
Okay. Any present illnesses recently? Any colds, coughs, anything that just maybe started recently?
I have a little bit of allergies, I guess, or something that I think I may have just developed, within the last couple of years. Nothing real serious. Usually just treated with over-the-counter medication.
Okay, so just maybe some hay fever.
Right.
Okay. Any allergies to any medications or foods?
No.
Okay. None ever, or just?
No real allergies. Like I said, when I had that surgery a while back, I did experience like some bad feeling once I take the pain medication.
So basically sensitivity to pain medication.
Absolutely.
Okay. Just briefly, can you touch on your mother and her history? Is she still living?
Yes.
Okay. And what type of medical history does she have?
Well, she currently, the only thing I can think of that she takes medication for is high blood pressure. Within the last year, she's had a total right knee replacement.
Any other surgeries for her?
She had a gallbladder removed as well as a younger person, in her early, probably 20s or something like that.
Okay. And no other surgeries that you can think of?
She had a total hysterectomy.
Okay.
She had some issues with that in her 40s.
Okay.
So,
do you have any siblings?
I have 2 older brothers.
Okay. And were y'all delivered via C-section or vaginal birth?
By the way she talked, I think we were all natural born, just natural deliveries.
Okay. And what about her her mother and father?
Hey, her father passed away probably in his 80s. He had a brain tumor. Um, that's the only real significant thing I can remember about him. Her mother, I think she's,
Any cancer with her?
well, nothing like in real particular. I think she's had some skin cancers, and I think she's developed like cancers here and there, but she is in her mid-90s. But she's had all that taken off.
Nothing with extensive treatment.
No,
Okay.
no chemo or anything was required. I think it pretty much was taken away.
And how many brothers and sisters does she have?
Who, my mom?
Yes.
7.
Okay. Tell me a little bit about your father. Is he still living?
Yes.
Okay. And what about his medical history?
My dad, he was recently diagnosed with diabetes and a little touch of depression. I think he's got elevated cholesterol problems. I think within the last 5 years, they've realized that he's had some issues with high cholesterol, so he's had,
A cardiac workup done?
yeah, all that was done, and he had a,
Stress test?
yeah, and they found out he had some like arterial problems, like with the heart and the
So
arteries.
they've done a cardiac workup
Yeah.
for him.
So
Okay. Okay.
Seems to be leaning toward that.
Okay. What about high blood pressure?
Yes,
Okay.
he does. That was also within the last few years.
Okay. And what about his mother and father?
His dad lived to be in his mid-70s. I think in his late 60s he had his first stroke. He had a blockage in his carotid arteries, and he had another one in his early 70s, which left him pretty disabled.
Any cancer with him or cardiac
I
problems?
think in his 60s he had prostate cancer he was diagnosed with, and that was kind of a off and on battle with that.
And he's deceased?
Yes, he passed away in his mid-70s.
Okay. And what about your dad's mother?
My grandmother was really good until about, I guess, 5 years ago. She's in her mid-80s. She was diagnosed with diabetes. Prior to that, as a young woman, she had 10 healthy children. She was a healthy lady, and that was really her first big diagnosis of that she had to deal with.
Okay. You mentioned that you had 2 brothers, 2 older brothers. What is their history, medical history like?
My oldest brother is in his mid 40s, and he's pretty fit. I mean, he's never had any problems.
Okay.
The middle brother, he's in his early 40s, and he's had some high blood pressure issues, I think, but they've been controlled with diet
Okay.
and exercise. So,
Okay. We're going to move on to your social history. Are you married?
yes,
Okay. And how many children do you have?
3.
All right. Do you smoke?
No.
Any illicit drugs?
No.
Okay. Do you drink any alcohol?
Yes, occasionally.
Okay. How occasional?
I'd say every weekend, and probably 2 or 3 beers at the most, or a couple of mixed drinks. Nothing more than that.
excessive. Okay. And what do you do for a living?
Small business owner. I have a little grocery store, and
So you stay inside a pretty good deal?
primarily, a lot of the time. But
Okay.
I do move a lot.
So no excessive sun exposure. Okay. And exercise-wise?
It's a pretty demanding job. I mean, even though you're indoors, you still move around a whole lot. Meeting the demands of the customers, and I do get a lot of exercise as far as walking is concerned. Or
Okay. So it appears to me that hypertension is a primary illness within your family, and you have established that the medication that you've been taking has controlled your high blood pressure, and that the medication that you're taking for your GI issues related to your gallbladder removal is also under control. Are there any other Anything else that I can help you with today besides establishing this primary health?
I don't think so. I just just have to get a baseline somewhere to start. And try to take more precautions as to what's going on. As I'm getting closer to 40. So.
All right. Well, this concludes my assignment of 9.2. Thank you.